So, welcome. If your legs feel heavy at the end of the day, if they swell, if you find yourself rubbing your calves, you might be dealing with a blood flow issue. But the problem goes beyond just leg pain or cramps. Poor circulation in the legs can lead to ulcers, ongoing pain, and in more serious cases, blood clots that travel to the lungs or brain, even strokes or heart attacks. These things can be an early warning sign. In fact, poor circulation in your legs is often a clear warning sign of clogged arteries, other places in the body, like your heart or brain. That's why today we're going to cover the most effective strategies to improve circulation right now, to reduce pain, and more importantly, lower your risk of heart attack and stroke. We'll go through all of it in about 25 minutes. And after that, I've got a new project I'm excited to share with you. Something I'm pretty sure you haven't seen before. Well, I know you haven't seen it from us, and I don't think you'll want to miss it. At the end, we'll also do our usual Q&A that we do on our live shows. Now, let's talk about circulation. Let me start with the basics. Blood flow is like a two-way country road. One way out from the heart through the arteries, bringing oxygen and fuel. Then the other is the return trip through the veins back to the artery, to the heart and the lungs, carrying away that waste and getting ready to get loaded up again. It's a beautiful system when it's working right. But the legs, being the farthest point from the heart, well, they just tend to show trouble first in a lot of people. Just understanding this flow in and out helps explain why your legs might feel off even before a diagnosis shows up. Now, here's where it gets interesting. You've got two types of highways in your legs, arteries and veins. Both move blood, but in opposite directions. And when trouble starts, it's usually in one or the other, but not both. Arteries carry blood away from the heart, high pressure, fast moving, full of oxygen. They're the supply lines, feeding your muscles and nerves. But when the arteries start to narrow, usually from plaque building up over time, you'll feel it when you try to move. You might notice your calves cramp up when you're walking. That's because muscles just aren't getting the oxygen that they need. We call that claudication. And for those of you who are not geeks, sorry about that. Claudication is just pain in your legs when you're walking. It eases up when you rest, but it keeps coming back when you walk, predictably. That's a classic early sign. It's called peripheral artery disease. That's a long set of words, so people just call it PAD. So if it keeps progressing, it can lead to ulcers on the skin, poor healing, and in rare cases, even amputation. So you see, this is serious stuff. Now, veins do the opposite job. They bring blood back to the heart, low pressure, slow moving, full of waste and carbon dioxide. But they've got a tougher road, especially in the legs, because they've got lower pressure, but they're working up against gravity the whole way. Your veins rely on small one-way valves to keep blood moving up. But over time, those valves can weaken, they can get destroyed, they can fail. When that happens, blood starts to pool down in the legs. And that's where chronic venous insufficiency, another acronym coming up, CVI, starts to show up. You'll feel heaviness, swelling around the ankles, and maybe some aching by the end of the day. Varicose veins, those big, ugly looking veins that crawl all over your leg or seem to crawl through your leg, those veins might show up. And if it looks like it's going on long enough, the skin can get dark, irritated, even break down, and that's where you get ulcers. So, while both arteries and veins affect circulation, they cause very different problems. And different problems usually need different solutions. If your legs hurt when you move, that points to the arteries. If they hurt when you sit or stand still, that's usually the veins. Either way, it's your body's way of telling you something's off with the flow, and it's worth getting it looked at. Now, I've seen three main problems with blood flow. I already mentioned two. Let me go deeper on this. The first one, chronic venous insufficiency or CVI. This one's it's slow, it's steady. It happens when the little valves inside your legs, the vein in your legs, wear out over time, and so blood can't get back to the heart as well, and it begins to pool down in those veins and starts to stretch those veins out, especially around the ankles. You might feel heaviness, swelling by the end of the day, even some itching or pressure when you start getting this problem. But it isn't a blood clot and it's not an emergency. A blood clot is an emergency. So the CVI, chronic venous insufficiency, is a circulation issue that builds up over months, even years, and it can be managed. Now, the next one is an emergency, deep venous thrombosis, or another acronym coming up, DVT. DVI, deep venous insufficiency, DVT, deep venous thrombosis. And for those of you who are not into the geek world on the medical side, a thrombosis is just a clot. So it's a deep vein clot, a blockage that forms in the deep veins of the legs, usually after long travel, like on an airplane, when you're not able to get up and move around, and you've got your legs all kinked up. Illness, surgery, or sometimes without a clear reason at all. It comes on suddenly. The leg swells, it gets tender, maybe warm or red. Now, here's the danger. That clot can break off, or pieces of the clot can break off, or the whole clot can dislodge and move to the lungs. That's called something else. Pulmonary, meaning lung, embolism, meaning a clot that has dislodged and moved. That's not just painful, it can be fatal very often. So if one leg swells up out of nowhere and it's hurting in a way that feels different, don't wait to see what's going to go on there. Don't give that 3 days. That needs immediate medical treatment. Now, let's talk about peripheral artery disease, or PAD. This one affects the supply side, the arteries. They narrow over time from plaque, and that limits how much oxygen-rich blood gets down to your legs. The muscles in your legs start to suffer, especially when you need more oxygen, like when you're walking. You might feel cramping or tightness in the calves. And the classic claudication is what we mentioned earlier. But here's the worst part. People often ignore it, thinking it's just aging or stiffness. And the other thing is, when it does come on, it just comes on slowly, slowly, slowly until, boom, you realize, dang, I can't walk. The real risk is deeper here. PAD means you've likely got similar plaque in your heart or your brain, even if it hasn't shown symptoms yet. So it's not just about walking more. It's about controlling blood pressure, cholesterol, inflammation, keeping the whole cardiovascular system healthy. PAD is a leg problem for sure, but it's a heart problem too. These three, CVI, chronic venous insufficiency, DVT, deep venous thrombosis, and PAD, peripheral artery disease, may all involve the legs, but they don't act the same and they don't respond to the same treatment. That's why it's important to know the difference between these things. It's critical to know the difference. So again, here's a quick guide. If there's a sudden swelling and pain, this is very likely DVT. Sudden, you need sudden treatment, sudden evaluation. If there's a heaviness and puffiness at the ankles, it might be CVI, venous insufficiency. If there's pain with walking that gets better as you rest predictably, that sounds like classic peripheral artery disease, PAD. But if there are ulcers or pain at rest, that's probably advanced PAD. Don't wait to be sure. If something doesn't feel right, get an evaluation. Now, if you're not in the middle of a clot or critical blood flow restriction, there's one thing I recommend more than anything. for any of the three problems. Guess what it is? Movement, moving your calf muscles. I heard someone else uh, talking about, hey, I just heard the calves are the second heart. Yes, they are. The calves are your body's natural pump outside of your heart. They get that venous blood going back up toward your heart. They also push your circulatory system into sending more blood to your legs. So here's what you can do right now, even from your chair: ankle pumps. You can do these sitting in a chair or lying down. Just point your toes away from you, then pull them back. Do it slow, 10 or 20 times. I have stairs in my house. I do, at this point, I started working out about 30 times with these toe raises, single one. Now I'm doing like 90 to 100 on each leg each day. These are great, whether you've got vein issues or not, but they're really good for vein issues because
8% of U.S.
sorry about that. These are great for vein issues because every time you move that ankle, you're helping the calf muscles squeeze blood back toward the heart. Now, they're not strong enough to help you much if you've got PAD, peripheral artery disease, that artery problem we talked about. So if your legs tend to swell or feel heavy after sitting, ankle pumps, toe raises, they're a great place to start. Now, we mentioned toe raises a minute ago. Let's go a little bit deeper on those. With toe raises, you hold onto a chair or you hold onto the guardrail, the handrail on your stairs or countertop, and just rock forward onto your toes, back onto your heels. This helps both veins and arteries. It gives that calf pump a stronger squeeze and get the full range of motion on there. It gets much harder when you lift it higher. And it makes more difference when if you're on a stair and you let it relax below your heel, go below the stair. This gets your blood moving in both directions. But again, it's not a full replacement for walking if you're dealing with PAD. So this is a nice in between if you're not walking as much or just need to loosen things up during the day. Speaking of walking, let's talk about that for a minute. You can start even in your house, just walking in place, even just 3 to 5 minutes. It's one of the most powerful ways to get started on recuperation, whether you've had surgery or you've got something going on with your arteries and your veins. It gets your heart going, it gets your legs moving, and it really helps arteries open up and deliver more oxygen. It also supports you're using calf muscles as the pump the whole time. So if you're able to walk, even in place while brushing your teeth or waiting on the microwave, that's one of the best things you can do for your circulation. Again, it wasn't that long ago, maybe 20 years ago, that surgeons began to discover, no, we don't want people to rest for 3 days after their surgery. The best thing we can have people do is get up and walk. Same day of surgery, if at all possible. Leg elevation. Now, this one's especially useful if your legs swell up by the evening. Just lie back, prop your feet up higher than your heart, couch your couch arm or your stack of pillows, whatever works for getting your feet up. It helps with that vein problem by letting gravity pull that blood back up and out of the legs, up or down, depending on your perspective, back up into your pelvis and your trunk of your body. Now, here's the thing. If you've got PAD and your legs hurt when you put them up or your feet get cold, that could mean there's not enough blood getting down there. Elevation can actually make it worse. So if your symptoms improve with elevation, that's a sign it's a vein issue. If the symptoms get worse with elevation, we might be looking at an artery problem. All of these things will help immediately with circulation. But there are additional interventions you need to be aware of to get the best results. Now, let's start with CVI. Without a doubt, remember that's the chronic venous insufficiency if you're not tracking on the acronyms yet. Without a doubt, you have to start with compression stockings for CVI, chronic venous insufficiency. It's the single best tool we've got. These stockings gently squeeze your legs, firmer at the ankle, looser as they go up, which helps blood move upward against gravity. It assists those second hearts that your calves are trying to provide. The key is they have to be properly fitted, not too loose, not too tight. And most folks give up on them because they bought the wrong size off the shelf, didn't really focus on the sizing, didn't get help because they just didn't want to, or they didn't have time, or they couldn't afford it. So if your legs swell or feel heavy by mid afternoon, get fitted and wear them every day, especially if you're up on your feet a lot. Now, people always ask me about supplements, wanting to know if I'm open to them. And many people know my history. I taught at Johns Hopkins. I was trained in classical medicine, and my position early on was supplements are worthless. They're just expensive urine. Well, then I got out to talking to more and more patients and began to realize there's a major focus there. So I did what I usually did at that point in time. I went and looked things up and found out that hmm, supplements may have a place, and there is real evidence, real scientific evidence for supplements in a lot of places. So I'm not going to push pills or powders, but some natural compounds have actually shown promise when it comes to vein health. Two in particular I've seen help some folks. You may not have heard of the first one, horse chestnut extract, specifically the compound eskin. You take 100 to 150 milligrams a day. It reduces swelling, improves tone in the veins, and relieves that heavy leg feeling. Micronized flavonoids like diosmin and hesperidin. You don't need to remember these names, but you can look it up after the video, or you can ask us and we can maybe help you in terms of getting some more information on them. The micronized flavonoids, they come from citrus peels, and they may strengthen the vein walls. They appear to reduce inflammation over time, but like anything else in the supplement world, they do not replace movement or compression. Lifestyle is always going to be king, even if we're talking about veins. So, if you're already doing the basics and still looking for a little extra support, these might be worth considering. Now, just talk it through with your provider, especially if you're on other medications. Let's talk about something else, DVT. Remember, on DVT, we're talking about diets. We're talking about clots. So if there's even a chance you might have a clot, maybe your leg's swollen, maybe it feels tight, maybe it's warm or achy. My advice is simple. Don't try to fix that yourself. Don't stretch it, don't rub it, and please don't go ordering some supplement you found on the internet that promises to thin your blood naturally. For example, nattokinase is very, very popular, but not for this. I get it. The idea of a blood clot sounds scary. And sometimes it's tempting to try something natural first. Natural. But this is one of those times where guessing wrong is dangerous. So the first step is to get a leg ultrasound. It's non-invasive. There's no radiation. It takes about 30 minutes, and it'll tell you right away whether there's a clot in there or whether there's not. If there is a clot, it'll tell you where it is. And at that point, then you can get proper treatment. And supplements are not sufficient. If they do find a DVT, a deep venous thrombosis, the standard treatment is usually a blood thinner, one that we'll call them anticoagulants. That may sound intense, but these days it's usually a pill. You take it once or twice a day, depending on the medication. Now, here's where a lot of folks get this wrong. They hear the word blood clot and think they need to stay in bed. In most cases, once the clot's being treated and you're stable, movement is again of the treatment, part of the recovery. Once you get proper diagnosis and properly started on the anticoagulant. Additionally, prescribed graduated compression stockings, like fitted ones, not just something off the shelf, these are necessary as well. They help with the symptoms, but more importantly, they lower the risk of what's called post thrombotic syndrome. That's where the leg stays swollen, discolored, and painful long after the clot is gone. Now, that happens when valves in the veins get damaged during the clotting process, and it can affect your quality of life for years if you don't manage it early. Again, if you act quickly, start the right treatment, keep your blood moving in a safe, steady way, most people recover without any long term issues. The tricky thing about a DVT, deep venous thrombosis, is it doesn't always come on loud. Sometimes it's just a little bit of a dull ache, a little swelling, and it doesn't really seem like that much of a big deal. That's where you need to be afraid. Be very afraid, because these things can be lethal. So I always tell folks, listen to your body. If something changes fast and doesn't feel right, get it checked. Make sure. It's better to know and treat early than to find out the hard way too late. Now, PAD. Remember, in peripheral artery disease, blood just can't get through fast enough to keep your muscles happy when you're moving. And that's the critical part. Movement is critical. So here's what to do: walk to the very edge of the pain. By that, I mean, walk until it starts hurting a little bit. This is one of those things. A lot of people react very negatively to the term no pain, no gain that came out with the movie Pumping Iron and some of the other stuff. We're not talking about joint pain here. We're talking about walk to the edge of the pain in those muscles, stimulate that, then get rest. Repeat. Do 30 minutes or more of this daily, at least 30 minutes. Now, I know it sounds backwards. Walk right into the pain? Really? Well, that's exactly what helps. The goal isn't to push through the pain, it's to walk until it starts, rest a moment, and go again. This interval walking actually trains the muscles to use oxygen more efficiently and encourages your body to open up tiny new vessels. That's what we call, and you may have heard this before, collateral circulation. Your body is responding to the fact that we're not getting enough circulation or flow through the arteries. Other areas that are collateral start growing wider. It's the same as traveling down the highway, driving up to a wreck, and you see everybody's getting off at that exit before that wreck, going around. That's collateral circulation. So even when the main pipes are narrow, you're building a better background system. If walking is not enough, a recumbent bike is a great alternative. I had one for years. Now, let's talk about supervised exercise therapy, SET. If you want the gold standard, this is it. SET is a structured walking program done in a clinic or a rehab setting, usually under medical supervision. You walk on a treadmill at a set pace, track your symptoms, rest, then walk again. Over time, this works. But not everybody has access to a center that offers SET, and not every doctor brings it up. So if your symptoms are holding you back, ask about it. Believe it or not, Medicare covers it in many cases, and the results are hard to beat. And as you're working, talking to your therapist about getting stimulating into getting a little bit of an incline on that walk as well. Home walking programs, they work as well. They work too. Not everybody wants to go to a clinic, and I get that. The good news is home-based walking can be very effective, just as effective, especially if it's consistent and disciplined. and ideally guided by a coach, app, or a check-in plan. But it does take discipline. You've got to show up for it, even when the progress feels like it's slow. Maybe this is not working. Don't accept that. Don't let your mind play tricks on you. Find something that fits your routine, a daily walk after breakfast, laps around the grocery store, even just pacing while you're on the phone. Small things count when they're done regularly. I've got a 94-year-old family member, very near and dear to me, and she will pace in the kitchen and the dining room. She's got a little track right around both tables, figure 8. Now, supplements that might help. Like I said, I'm not the one to reach for supplements first, but in PAD, a few have shown real promise, mostly in folks who are already walking and managing their risk factors. Somebody I know has already guessed it. Citrulline, 3 to 6 grams twice a day. It helps boost nitric oxide, that thing that dilates your arteries. It opens up your blood vessels and improves walking distance. It's always worth checking for vitamin B12 and vitamin D deficiencies. Both are common in older adults, and low levels can make circulation worse. But remember, supplements are just what the term says. They're supplemental. So make sure the basics are in place. First, movement and fixing the root cause, metabolic disease. This last part is usually something that most people miss. There's another major factor, and that is our broken medical system. Let me explain. Most people never get the full picture of their own health. Short visits, how you doing, Mrs. Jones? Let me write you a script and get out the door to see the next patient so I can get paid. Limited testing, quick prescriptions, and a lot of confusion. What almost no one gets is a long, careful evaluation of their own environment, where we can see what's actually driving their condition. So I started traveling to patients' homes across the country, believe it or not, to evaluate them properly. Real conversations, real testing, real lifestyle assessment, and nothing staged, nothing scripted. I've decided to turn this into a series for you. It'll show you exactly how chronic problems develop and what it actually takes to turn them around in the patient's home. So you'll see the process step by step with real people in real home environments. Our first episode follows a patient in Texas. He's dealing with serious mobility issues. The series will start here on YouTube on the 13th of December. That's this coming Saturday. But now I want to play a quick trailer for you. This will be the first episode of Dr. Brewer's House Calls. I'll be waiting for you in the premiere. Now let's go to the Q&A, and I think our folks are very eager to show it to you, aren't they? Can't hear you, Jesus.
I'm sorry. Let's see the trailer. I apologize. I've been screwing up the text on the back all morning. Let's see the trailer, and then let's go to Q&A.
8% of U.S. adults have vascular disease. It's the #1 cause of heart attack. In this series, I'm traveling all over the country to help people cure their chronic disease.
He has definitely told me, I don't want to live anymore. The pain is too much.
We have to get him walking.
We like to go camping, and she loves to go for walks, and I can't walk very far.
And you can't go?
No.
Harlan's got over 50 years worth of the worst thing you can do to your arteries, smoking.
I don't really want to scare Harlan and Linda, but I really struggle trying to find the pulse.
So as you saw, we're very excited about this. I wanted to show the trailer as soon as possible. All right, Dr. Brewer. So before we go to Q&A, the main question everybody has, what's up with the glasses?
Oh, I thought I've been getting into Ray Charles recently, and I just thought maybe I could look like. No, I had cataract surgery a couple of hours ago. So yeah, I didn't expect to feel this good. I saw one of the I saw a YouTube short about a week ago of a ophthalmologist who filmed that short about 2 hours after his cataract surgery, and I said, "Dang, I had no idea." And it itches a little bit, but and I'll have to be wearing or UV light protection for a while, but other than that, it feels good. And the difference in my vision is dramatic.
So glad to hear that. And I know that your case wasn't severe enough, but it really helps when you go ahead and just do something like that.
Yeah, there's a strong case to, like most other things, go ahead and get it done before it gets bad.
Exactly. Prevention, isn't it?
Prevention.
All right. So let's go to Q&A. I have 2 items before we do that. First one, let us know in the comments on the chat, what do you think about this series on Saturday? If you're going to be joining us, the plan is we're going to show the video on Saturday, 11 a.m. Eastern, as usual, and Dr. Brewer and I are going to stay after that to answer any of your questions. If you've seen enough and you say, I would love to be a candidate for that show, on the description of the video, I put a link, a form where you can be a candidate. Doesn't matter where in the U.S. you are. Dr. Brewer is one of the few doctors licensed in all 50 states, and I'll bet to say the only preventive medicine doctor licensed in all 50 states. And that's why we can do that.
Safe bet.
Yeah.
And we're still at a point right now where this is free, right? We're not charging folks.
Oh yeah, for sure.
Because here's the thing: is you'll see in these videos, it speaks so much louder and so much more clearly when viewers are able to see the real story. That's our goal for the patient. For the patients that agree to open up their home and their life to this, we're saying, look, no charge for what we do.
Exactly right. All right. So let me go ahead and put a little transition. Then we go to Q&A. I love that thing. Okay. So big shout out to Mr. Nightstar for just becoming a member. Thank you very much. And Chon Hawa just become a member as well. Thank you so much. It's easy. It's very cheap. $5-10 a month for being a member. And what happens is we will answer your questions first. And also, we have come to a point. We started this like a year ago with the members only thing, as just as a way to show appreciation. And at this point, we have like over 60 videos exclusive for members only. We're putting one out every month where I answer your questions, or we also sometimes just talk about stuff that probably is not going to be as popular on a regular video, but still is something that we want to bring out for people. So if you become a member, you get some extra perks just for the extra support you're bringing. And if you're not ready to be a member, we still love you. You just subscribe and you'll still get tons of stuff for free.
We've got like what, 800 members now?
Like 800 members, which is fantastic. We are really, really appreciative of that.
So if you're thinking that it's not a big deal, it's not much, you add that up times 800, and it really does make a major contribution to the budget of getting these videos out there. So,
oh yeah, for sure,
it's a big deal.
There's you can't even imagine how large the team has become after a couple of years, and there's some bills that need to be paid.
Yeah, they see you and me, mostly me, but we've got what? And just on the channel alone, we've got how many editors?
Like 3 editors and three in-house editors plus external editors, plus people working on the thumbnails, people working on the counseling, people working on practice itself.
A couple of dozen people total involved.
Health coaches,
yeah,
admin people. All right, big team, all to support Dr. Brewer's goal, which is, believe it or not, it's not making money. Dr. Brewer,
not going to make money otherwise.
Dr. Brewer is actually putting the money from his pocket, I believe, and he will be out there just playing golf, miserably playing golf, not worrying about this, but his goal is to actually help people, and that's what we're trying to do here. So we really appreciate you guys. All right, let's go to questions. Tony D. Lawler, good morning. Happy to learn. We are all learning. Nipa Gandhi from Calcutta, India. Good morning. Harlan.
Oh, there we go.
I mean, I don't know how much we can say when he's not on the show. I just Harlan. We're excited about this Saturday.
Very excited to hear from Harlan.
Rick Folia, good morning from Atlanta. And now we got to the first question. How do you tell the difference between PAD and CVI and neurologic deterioration? There are a couple of subtle signs, some of that. Some of those overlap, but clearly PAD and neurologic issues are way more severe than just traditional chronic venous insufficiency. To begin with, CVI will manifest with varicose veins. PAD will have more like Dr. Brewer described during the talk, like you walk and then you have the pain, you rest and the pain goes away. Neurological usually comes with loss of strength and loss of muscle. You can get some muscle loss too in the other on nerve damage. It's a little bit more evident. Also, you can get some issues moving certain toes or doing some certain moves when it's a nerve damage issue. Anything else you want to add to that, Dr. Brewer?
Sure. Some of the most susceptible arteries are for these problems are the microscopic arteries, the arteries that supply nerves themselves. So one of the first things that you see in some people is nerve damage. And the nerve damage is actually coming from the fact that those microscopic arteries that supply the nerves are damaged and can't supply blood supply, can't get oxygen to the nerves, can't get those waste products out. So again, all of these are different versions of that term, that old term, canary in a coal mine. They're problems in and of themselves, but they're a major warning sign.
That is a really good point. And actually, you know this, to the audience, guess what's the number one cause of nerve damage on legs? Diabetes, metabolic disease, insulin resistance. Damages both nerves and the vessels that feed the nerves that Dr. Brewer just described.
Number one cause of claudication and PAD, peripheral artery disease, is the number one cause of nerve damage.
Absolutely. What's with the sunglasses? Well, we just explained. I just want to mention Bugs Bunny. AI, only the images we used on the slides. As you can tell, we're real people. But AI could do this? Probably not yet. Joey T, is it good to exercise to the edge of angina pain or keep exercising through the angina? That's a really, really good question. It's not so much about leg issues, but still about clogged arteries. I know you are going to be eager to answer this one.
You know, I am.
I know you're eager.
You're not going to try it.
I have heard you.
So there's a thing called walk-through angina, and that's where you start getting some angina predictably when you start on your walk, and then you continue to walk and the angina goes away. As you might guess, think about what that means. Basically, you remember we talked about the fact that these arteries in your heart are not like rigid pipes. Mm-hmm. They can expand. And that's exactly what's going on with walk-through angina. With heart failure, with angina, with almost anything in this space, exercise helps. It is very, very helpful. One thing that you want to be careful of with angina is change in character of angina. That's called crescendo angina. If your angina suddenly starts getting, if it increases, it gets worse, it starts happening earlier in your walk up that hill, that needs to be evaluated. But I don't know if that was what I said before that you knew I was going to say, Jesus.
That's the same answer I have heard you say before. I will only add to the caveat, a caveat here. Sometimes it's hard to differentiate between a heart attack and an angina. It can be different. Angina can be the chest pain that you go there, then you rest, and it goes away. That's what we call a stable angina. Like you can't have the pain. If you rest, it goes away. Usually you have extra symptoms. It could be the cold sweating. It could be the arm that goes to your jaw, to your one of the arms to the back. Even you can feel a little bit dizzy, or some people just faint. Gotta be careful about those. So we usually do not just recommend people going through angina until they're actually evaluated and we can identify the real cardiovascular risk, not just blood flow issues, but also what type of plaque you have and what is the possibility for you to have an active heart attack in the near future. And then we titrate the exercise based on that.
It's an excellent point. You hear me talk about no pain, no gain a lot. When you have chest pain that has not been evaluated, that is not angina until heart attack and serious things have been ruled out. So angina is something that's been diagnosed, it's been worked up, and it's really clear that that's what it is.
Absolutely. All right. Do you have an opinion? Thomas Handyside, do you have an opinion on interval walking? 3 minutes fast, 3 minutes slow for 30 minutes. I have read some good things about it. I think you do. Want to go ahead?
I think I do too. Jesus and I have been working on a video that's coming out, I'm not sure when, that discusses that exact topic. A lot of it started in Japan. Not sure how they got credit for it, but interval walking is a big deal.
Yep.
If you're at that level of exercise, anything that that increases intensity in bursts.
Yep. And also there are different protocols. We like to do the 1 minute in, 1 minute off. You can do 3 minutes, 3 minutes off. At the end, pushing your body to certain boundaries, and specifically for blood flow issues, as we saw during Dr. Brewer's presentation, trying to build some of that collateral circulation in the cases of PAD, or also just strengthening your calves. So those calves and muscles are pushing the veins so the blood can go back into the heart easily. There's no way around it, guys. I know we love supplements. We love or trying to fix this with a pill, but movement is medicine. There's no way around it. Does tadalafil do the same thing as cytotroline, which I'm not sure if the right thing. I was doing some research on it. Cytocholine, that's what I have heard, and it's clearly not the same thing as tadalafil. But I don't know if they actually do the same thing. I mean, I don't have enough information about it to really.
I don't have enough information about that either. I think we all know that tadalafil is a PBDE 5-phosphodiesterase inhibitor. Basically, what it does is it increases nitric oxide specifically within the prostate, and that helps immensely in terms of prostate health.
Absolutely. Harlan, I'm up to 20 minutes on the bike and treadmill each. He's just spoiling the beans, but okay, not spilling the beans, spoiling the beans. That's fantastic, Harlan. I mean,
it's a great story.
I mean, I don't know what else I can say without spoiling the beans myself. I want to mention something. We're working on the settings on all this stuff. We shared a couple of links on previous posts, and we're going to share a link here. We're trying to premiere this thing, so you know it's coming. So yes, we will be sharing links on multiple places. You can find it on Facebook. You will be able to find it on the community posts. I'm going to make sure that we have a link on the pinned comment on this video and other videos. And if you don't get a link, just as usual, just tune into YouTube. Every Saturday morning, 11 a.m. Eastern, we're going to have something for you. This is it for this Saturday. Okay, Ruben, is it a good idea to do HIIT, high-intensity interval training, if you have heterogeneous plaque, which is mixed plaque? To us, what we have seen is mostly a stable plaque, but it might have some components in there that are not fully calcified on the bulb. And when he says the bulb, he means the carotid artery in the middle right there. I am afraid it might get dislodged and travel to my brain, which is a real concern. What do you think about that?
So you bring up a great point. Despite the fact that I do this for a living, I remember the week that I discovered my own plaque. It was heterogeneous. There wasn't very much of it. I was 57 years old. It was at a Bale Dunning event where Vesa Labs and Cardio Risk were there doing these, and I got mine, and I had some plaque, and it was like, dang, that's not a fun time. Jesus and his generation, most people in his generation haven't quite lived through finding that you've got plaque in your arteries. Now,
I don't have it. At
Yeah,
least until this point, I haven't found it.
good.
Yes.
And you're going to get it a lot later than you would have had you not done what you're doing.
Absolutely.
So I remember at that time period, I would take about a 2 to 3 hour run. I lived in Lexington near Keeneland Racetrack, and it's booked as one of the prettiest half marathon in the country. Whether it is or not, they think it is. And I can tell you, it is gorgeous. It's going right through the horse country of Lexington. But about 5 minutes into my run, it occurred to me that I had plaque in my artery, and it was heterogeneous. So by definition, at least some of it had some soft character. We didn't understand that characterization as well at that point, and we can get into that, go down that bunny hole later. But the question is, and I'm getting ready to go run in a couple of hours, and if I have a heart attack, and if I'm one of the, I'm running a 1 in 2% chance of collapsing by the side of the road in a ditch next to a horse farm, and they wouldn't find me for a long time. Yes, all that passed through my brain. Yes, all that fear was there. And then I had to tell myself, well, now, wait a minute. This space. You do this for a living. Is this going to increase your risk of a heart attack? And the answer is no. People say, oh, you can't work out because of the risk of a heart attack. You can't do HIIT training because of the risk of a heart attack. You can't climb stairs. It's some of the core of what we were talking about in the video content in your extended intro today, or my extended intro today, that you got to push it, and the evidence is really clear. So after going through that emotional, I know it's scary, but I need to move on, and I know I know from the facts, the evidence, this is not going to increase my risk of having a heart attack. In fact, this is going to decrease it. So that one run was that emotional moment. Once I got going, I moved ahead. And so you need to do that too. I hate to say that. To get more to the science space, there's a fellow named Honda, not the Honda with cars, but a medical researcher. He took a bunch of people with plaque and looked at them. He measured them looking at using CIMT, carotid intima media thickness test. And the people that had soft plaque, in other words, no calcification, just continued to have heart attacks, events, strokes. The people that had heterogeneous and echogenic plaque, they stopped. After a break-in period of the first couple of months, there just were no. The risk for someone with stable plaque, and heterogeneous is stable plaque, is about the same as somebody without plaque. Now, the concern is, okay, if you fall off the wagon, those heterogeneous plaques can soften up and create risk again. So a heterogeneous plaque should be a major, even stronger motivator to not fall off the wagon.
Yep. And just to add on top of that, the risk of a plaque from the carotid artery to go to your brain and cause a stroke is somewhere close to 0.5 to 1%. So it's not zero, but it really depends on what Dr. Brewer just said. There are some people that will go through interventions and get a stent on the carotid artery, which is not easy. It's not an easy procedure. It will give them some peace of mind. But even if you get that done, similar to a cardiac stent, if you're not doing the lifestyle component, if it's not that clot, what's going to get you? It's going to be a heart attack or a stroke from coming from somewhere else. So regardless, you got to do the work. And we usually, before prescribing any kind of high intensity interval training, we like to evaluate first. Because of these specific concerns.
Yeah, there's some people who should not be doing it. For example, people with unstable angina, crescendo angina, they should not be doing that. They need to get stabilized first. Now, if you rewind 2 years ago, you and I would be standing here talking about it, and that would be the end of the story. You might at that point be asking and encouraging CTA with AI, computerized tomography, or CT angiogram with AI analysis, and I would still be dragging my feet. Since then, I have learned my lesson. I got my own CTA with AI, mostly for the purposes of the channel, but I can tell you it was very reassuring for my own purposes to see exactly what a, quote, heterogeneous plaque, end quote, meant. For me, it meant practically zero unstable plaque. So
yeah, it was reassuring to me knowing that my friend and boss was not going to have a heart attack in the near future. Let me tell you that. My wife was happy too about that. But yeah, I mean that's good. And then you can do extra stuff. You can push your boundaries when you're certain that your risk is low. All right, Roger L.A. Mason, please come to my house. Kept a log of my low-carb diet for 2 years per Dr. Brewer's advice. I just had cataract surgery and have Brewer ancestors.
Oh, really?
Brewer,
we'll have to compare family trees.
Oh, yeah. Where's the sign-up form? Volunteer previously. So I can tell you this. I personally send an email to everyone who has volunteered before. So you might want to check your spam folder just in case, but there's a new link on the description of the video. So it's a very similar form. Just if you may, please go ahead and fill it out. And I am contacting everybody who is signing up for this personally, either email or phone call. So yeah, please, I will appreciate if you can go ahead and just reapply.
And pardon the interruption.
Sure.
And if you're like me and you're more comfortable with a phone call, isn't it 859-721-1414? Or is it
well, yes, it is. But still, I will suggest people just to go ahead and fill the form because we keep control on every candidate that way.
Okay,
you won't be surprised.
Control freak.
No. But I'll explain later. There's a train passing by. I'll let you the next question.
Jesus lives next to the train track. So he has, you talk about stress, he has to juggle talking and his mute when the train's coming by.
Yeah, and it just left. Yeah, but it's not so much I'm a control freak, but you will be surprised how many people have actually volunteered, even if we haven't released the first episode yet. So it's a big leap of faith. But I expect that once they see the first episode, it's going to be clearer what we're doing here. And as we say during the interviews with the candidates, our main goal is to help you. It's not exposing you. This is not scripted. We're not trying to get to the gotcha moments and everybody to see that you're doing something wrong. It's about identifying what you're not doing well, help you out with that, and actually give you something that you can use from now on to improve your health. And then we hope to inspire people into realizing that there's more people dealing with stuff like that, and there's a way out, and there's hope that you can fix your stuff. So that's the whole point. Nipa Gandhi, sitting dentistry causing pressure on piriformis muscle, resulting in sciatica-like pain. How to deal with that? So I'm guessing this is a dentistry. Who is the patient, right? The dentist.
I can't see it. You have your
the
eye that was done today was going to be my short vision eye, so it's all fogged up.
It's all what? You're going to get us demonetized. Okay, so if did you say F-O-G?
No, fogged. Oh, you thought I said something. Hey, Sus, you know me better than that.
Oh yeah, I've never heard you say that. Okay,
Well,
so
I won't say
I mean,
that.
this sounds more like orthopedic muscle
Piriformis.
rehabilitation stuff
Yeah.
rather than cardiac vascular. I mean, my first thought will be just getting some of that evaluated, getting help with a physical therapist, and there are clearly exercises and therapies to remove the inflammation of the peripheral if that's what's causing that. Usually that helps, and it has to do with that because the sciatic nerve goes real close to that muscle. So any inflammation of that muscle can press the nerve and cause all of that issue. But yeah, like I don't think that's something that you can just figure out on your own unless you really know what you're doing. Prayer for Dr. Brewer is now on my prayer list for speeding healthy recovery. Thank you so much.
Thank you very much. I do appreciate that.
And yeah, people are some comments here. Not waiting. Can't wait to see the video. I would like to be considered a candidate. Yes, please go ahead and fill out the form on the description of the video. We'll appreciate that. And I'm gonna pin it on the comments too. So if you don't see it on the description, just revisit the video in a couple of hours, and I'll put it on the comments as well. Right here, yeah. And I think Aspen helped us with that. Like you can see the link here. Hopefully, it's something that you can click on the chat. Would love to go to France.
France.
That will be nice. Maybe this video gets it's successful enough, and we're able to grow as much. We can do an international house call version. All right, so that's what we have for you today. Any closing remarks? We did it less than an hour.
Oh wow, that's really good, and especially with that intro. So no, growing old's not for sissies, but it's a lot easier with healthy arteries.
You really wanted to put that out there. All right. Talk to you later, guys. I love it. See you next Saturday.